So, welcome to our info session on paediatric palliative care. Before we get started, in the spirit of reconciliation, Alongside Families would like to acknowledge the traditional custodians of country throughout Australia and their connections to land, sea and community. We pay our respect to the elders past and present and extend that respect to all Aboriginal and Torres Strait Islander peoples today. My name is Pam, and I'm joining you today from the land of the Ngunnawal people. You're very welcome to share the name of the country that you're on in the chat. I'm really excited to introduce today's guests to you. Today we will be hearing from Annette Vickery. She's a dedicated project manager with over 10 years experience supporting families through her work in aged care and 5 years with Palliative Care Australia. So today's session is going to cover what paediatric palliative care really means and hopefully dispel some common myths that the general population society may have about paediatric palliative care, who is a part of the paediatric palliative care team and what they do, and how and when to access these services to better support your child and your family. We are aware that some of today's content may bring up some really strong feelings. So if at any point you feel uncomfortable or distressed, please feel free to mute audio, step away for a moment, or if you're watching the recording back, simply fast forward through any sections that don't feel right for you. Please take care of yourself wherever you may need. So, without further ado, I'm going to hand over to Annette. Thank you so much and welcome.
Thank you. I just wanted to check before we get started that you can see the presentation I have up on the screen.
Yeah, perfectly.
Excellent. So as was mentioned, my name's Annette Vickery. I'm the Projects Manager for Palliative Care Australia. I don't have any clinical experience, but through my work over the last 5 years with Palliative Care Australia, I've worked alongside many families and health professionals and have learnt so much. So hopefully today, through my presentation, you'll find something there that's useful for you. So paediatric palliative care, I like to start with, it's about support and care for children and families with life-limiting conditions to ensure they have the best quality of life. It focuses on social support, psychological support, help navigating complex medical needs, cultural support. A whole range of services are available for families. And each family is different and unique and have different needs. And palliative care is provided based on these needs. Now, I do have a video to share with you today because, as I said, I don't have any lived experience or clinical experience, and the families that have are the people that are best to share what paediatric palliative care is about. So bear with me and we'll see if you can hear the audio. I'll try one more. I'm just going to try and go onto our website and see if I can access the video from there. Apologies for this. It was all set and then technical issues. Okay. So I'm just going to stop sharing and then try sharing again. Sorry, everyone. I don't think it's going to have...
perfectly fine. We're all only human.
Share the screen. Okay, well, just if it works later on, I'll definitely go back to that.
Amazing, thank you.
Can you see the PowerPoint presentation now?
No, it hasn't popped up yet.
Okay. Would you be able to see if you can allow me access to share again? Doesn't seem that.
Sure. No, you're still a co-host, so you should easily be able to share.
Let's show again. Okay, what about now?
No.
No. All right, well, I might just keep talking.
Yeah.
Apologies for this. So we do have a video called Demystifying Paediatric Palliative Care. And on this video, we have two bereaved mothers, Preeti and Beck. Petey and Beck both had very different experiences. One child, Mark, had a genetic condition, and Preeti's daughter, Zia, had a neurological condition. And it just talks about initially hearing pediatric palliative care for the first time, how scary it was, and thinking about, well, this is end of life. This is what adults have. This is what palliative care is about. But for children and young adults, it's very different. Families are often under palliative care for a long time. They can be referred to palliative care from diagnosis, anytime through the child's life, and also paediatric palliative care can come in to support families after the loss of their child. A lot of families tell us they wish they'd known about paediatric palliative care earlier. The impact that the team had on the families was life-changing, which is something that the families talk about in this video. And it's not about the palliative care team taking over the treating team. So if you're seeing an oncologist or a neurologist, they continue to be with you when paediatric palliative care is introduced. So you're not losing that team and those people that you've learnt and developed trust with. They will continue to be there beside you as well. Paediatric palliative care, I think, should have a change in its name. It should be quality of life care, and this is the team that can support you with that. Just going to click through my slides. So for families, quality of life care can be very different. It could be that your family want to go on a holiday, your family want to enjoy time together, going and creating things together. It could be that their child is pain-free, and that is the main goal for them. And palliative care, you can have art therapy, music therapy, physiotherapy, occupational therapy. There's many, many things that you are able to access through the paediatric palliative care team. Now, each team is very different across the state and territories. Some have more staff, some are only located in the cities and not not rural or remote. There's nurses, occupational therapists, doctors, nurses, spiritual support. So lots and lots of specialties in there. But it doesn't mean that you have to use all of them. It's trying to find the right fit for you and your family. But if you can't find a specialist team or not located near a specialist team, we also have community supports available. We have nurses in the community. You've also got NDIS that some families have access to. And paediatric palliative care can come in and out of your journey. So you might be introduced at diagnosis and everything seems to be going okay. So palliative care just moves aside. And then there may be some medical issue and then you call on them again. And it is the whole trajectory. We have children under palliative care that also transition into adult services, and also sometimes children are what they call discharged. But the palliative care is always there. They know you and they keep your file there. So if you do ever need to call on them, they are available. So when we're talking about keeping the treating team involved, they call it parallel planning. So what they like to talk about is it allows families and teams to plan for many different pathways. It could be that you're having treatment for conditions and you're working towards a cure. But you're also planning for the chance that that may not happen. So they work along parallel with each other. So it's really recognising both the hope for life and recovery, but also the possibility of deterioration. I do have another video here, and I'm just going to quote what one of the parents in this story talks about, and they refer to paediatric palliative care like the torch in the dark. So not only are they there to provide services like physio or art therapy or nursing and pain management, but also to help you with those questions, wanting to share your hopes and dreams. They're there to try and overtake or manage some of the barriers that may pop up through medical systems. Thinking about what if scenarios, they can help you looking at certain treatments. Is this something that you want? Is it going to benefit your child and family, or is it time to look at a different pathway? Memory making is another important aspect of the PED-PAL care team role. So memory making can be doing some artwork, creating casts of your child's hands and feet. It was also about those everyday moments, and you may just want to be able to be there as a parent, not as a carer, being able to immerse yourself in that moment so the team can be there to support you so that you can be in that moment. Okay. Just trying to remember everything on my slides. A lot of the time we find that paediatric palliative care team are the ones that are contacted in the middle of the night or 2 a.m. in the morning or on the weekends. And there may not be a specialist team available, but there's always contact numbers, there's always information available for you, and then there is the community nursing if you're at home. It's very important. Not every family wants to be at home, not every family wants to be in hospital. There are also options for respite. So there's a team of people that work in a hospice, and obviously this is another term we'd like to change. A lot of people think hospice again is end of life, but for children and the services that we have around Australia, it's very much about providing that space where people feel safe and supported and also able to enjoy time with their children, but also feel safe to leave their child in the care of a supportive team. The other thing that Paediatric Palliative Care team also provides is support for siblings. Often families are so focused on the child who is unwell or has a life-limiting condition that it's hard to manage the time to spread across. So there are lots of camps available for young people and siblings. There's also support for teachers as well, so that If one of the goals of the child is to stay at school, we now have education available to teachers to support that child in the school environment. And we're working towards helping friends as well and community services. If they enjoy football, how can the palliative care team help them attend a sporting event? A lot of the time, families also feel like they have to know everything about how to provide care, what medications to give, how to give it. But sometimes families just want to be mums and dads or grandparents. So the nursing teams are always there to guide you through those things. But it's very unique for Paediatric Palliative Care team. They realise and recognise your expertise as well, and they respect that. They are guided by your expertise because you're with them all the time. Just wondering if we might now jump to questions. Trying to remember all of the PowerPoint off the top of my head. I'm sure I've jumped around, but very open to having questions from anybody today.
No, thank you. That's been some really excellent information, Annette. If anyone has any questions around the information that Annette has shared today, or like around accessing pediatric palliative care or anything like that, feel free to pop it into the chat. So, how do our, like, can you talk a little bit around to like the topic of like almost like the criteria and how families access pediatric palliative care? Like what are the steps
Absolutely.
involved? Yeah.
Okay. So as I said, children and their families can be referred to paediatric palliative care from diagnosis. But this doesn't always happen. We do find that some specialists feel like they're giving up on families or have failed at their job. Now, we know that paediatric palliative care is not about giving up or failing. It's about providing an additional layer of support for families. So we are educating and empowering health professionals, neurologists, oncologists to understand that so that families can be referred earlier. So if your referring specialist hasn't referred you to paediatric palliative care and you believe that this is something you want to discuss, please raise that with your health professional. You can also contact the paediatric palliative care yourself. You do need you need to meet the criteria, and there is a process in every hospital. So even though you're contacting the paediatric palliative care team, you can have that discussion and they can support you in how to get that referral through to them. Sometimes it is just saying to the health professional, what about paediatric palliative care? Can that help me? We don't want families to have to do that. We want the health professionals to guide you. But if they aren't, that is a way to do it. In regards to hospices and respite care, you can self-refer to that as well. So with criteria for paediatric palliative care, they do use a gauge, and there's 4 different areas of a life-limiting condition that they use. Just going to see if I can get it up so I can tell you. It's life-limiting and life-threatening. So there's lots of different ways. It could be that the condition is not curable, it's progressive, it's advanced, and some of these things could be cancer, there's childhood dementia. Also, if children have heart conditions and they may need a transplant, they can also go on to considered that for paediatric palliative care. We also have antenatal and neonatal conditions. So there's lots of different conditions, and they're basically the criteria. They also look at whether your child is stable or unstable. Also looking at families' needs. Is it that they're struggling? They don't have the knowledge or they don't have the support around them to deal with some of the things that are coming up. So that's really what it is. Each state and territory is different, again, based on the capacity of the team, also what they have in their team, what roles that they have. But definitely raise it with your referring specialist if they haven't. But yes, we are trying to encourage that from diagnosis, and it may be just planting the seed and letting you know that that service is available. You may not be ready for that, but at least you know that there is that additional layer of support.
Yeah, beautiful. Thank you so much. We've just had a comment in the chat. Does pediatric palliative care differ from state to state or region to region? Our local PAL care team says nothing that they can do to help with and help them until the child requires end of life medication or pain relief, etc. This child is not curable and is degenerative or progressive.
So with the first question around state and territories, every service is different. For specialist palliative care, that's delivered in the hospital setting. Some teams are quite small. They may have a nurse, a doctor, and a social worker. So their service is limited and only have capacity to take on a number of patients. Other services, as I said, are quite large. They have Aboriginal health workers, art therapists, music therapists. So yes, unfortunately, it's not equitable across Australia. We again are advocating for this so that everyone has the same high quality level of care that they deserve, no matter where they live. Community specialist services, again, a lot of them don't see children very often. So they aren't confident in providing that care, but they can provide that care and should be providing that care in the community. It may be that some community services don't have capacity, unfortunately, to see children until they are at the end stage of their life. But that's where also you reach out to the health professionals and say, I don't have any services available to me in my area. What other things can I do? Who can I contact? We do have member organisations in all states and territories, and they will be able to help families find services that are available. Palliative Care Australia is a national body, so we're not service providers. But on our website, we do have a service finder, which you can put in your state and territory, and then it should pop up with services that are available to you. Again, it's not end of life, and that's not the holistic philosophy for paediatric palliative care. But as we know, with the health systems, it's unfortunately not equitable, and we are fighting to make that change.
Yeah, beautiful. Thank you so much for clarifying that. It can be a real struggle for some families, but knowing that there's like almost an index available on your website where they can go, and at least it's a starting point to kind of access and have some idea of what services are available in their area. That's really helpful. Just before we wrap up, do you have a piece of advice or some words of encouragement that you would give to parents and carers who are navigating the complexities of their child's medical needs?
Reach out. reach out and make those connections, because the people in paediatric palliative care are passionate and are wanting to help families. So don't feel that you can't ask questions, or if you're being told information and you don't understand it, because sometimes health professionals use their medical jargon, just ask them, does this mean this? Or because you don't want to have to go onto websites and look for information. It's so challenging. So I don't want to put all of this on families, but sometimes we have to dig deep and ask those questions, and always remember that there is support available to you.
Yeah, beautiful. Thank you so much, Annette. It really aligns with the message that I'm sure you're all sick of me telling you, that you are the expert in your child. And if you don't feel safe or comfortable with the information you're receiving, you're allowed to ask questions, you're allowed to find out what's going on, and you're allowed to ask for help and invest in services that are going to help you better understand what's going on with your child, because you guys are the experts and your gut knows if something's going awry. So thank you so much, Annette. Today has been really informative. I've loved listening to you chat, and we really, really do truly appreciate the time that you've taken today to present to us and share your valuable insights and expertise with our community. So thank you so much. And thank you to everyone who's watching right now and who's going to watch the recording back. We really do appreciate your engagement. And you just being engaged and listening and being a part of all of this is what makes these sessions so valuable for everyone. So thank you. Just a quick reminder to finish up. Over the next few days, anyone who has registered for the webinar will get a link to the recording from today. Annette has very generously said she will share the slides. Even though we didn't get to see them in the presentation today, we will get them in the email. Amazing. And I will also make sure that the links from both of the videos that Annette has mentioned today is also in that email. So you will be able to hear from the families that palliative care has been able to help. You'll be able to hear from them directly. We will also make sure that contact information for Palliative Care Australia is in that email as well. So if you're feeling like there's a little bit of gap in services and you need to work out what's going on in your area, you can check out their website and hopefully find something close by for you. And of course, as always, there will be the different various ways that you can connect with us here at Alongside Families to further continue this conversation and just feel like you're not alone in all of this craziness. We are very excited to announce that we've launched a brand new Facebook community just for families who have children with disability and high medical need. It's a supportive space where you as parents and carers can connect with others who truly, truly understand the journey that you are facing, share tips and advice about navigating hospital stays in the healthcare system, and find encouragement on harder days, and most importantly, celebrate those wins. Hooray! If this sounds like something that would support you and you would like to be a part of, there is a link. I'm going to pop the link to the form in the chat right now. Oh, no, I'm not. Yes, I am. My computer's not cooperating. It's in the chat. So if that's something you would like to be a part of, please jump on, fill out that form, and you can join us in the group. The link to this will also be in the email that we send out, so don't stress too much. As always, socials, love you coming on over, having a sticky beak, Facebook, Instagram, whatever you feel comfortable in, and make sure you subscribe to our newsletter so that you get regular updates about all of the cool, amazing events that we provide for you guys at Alongside. Last week of term this term for New South Wales. So just make sure you jump in and get a hold of the last few little events for term 3. We have Shaping the Future. It's from the genetics webinar series. That's on tomorrow. So if you've been following along with the genetics webinar series, make sure you jump on and don't miss tomorrow's session. I will also make sure that in the email there's a link so that you can register for the entire series, and you'll get playbacks from the whole series if you've missed some of them. And if any of you missed our session with the Clinical Excellence Commission a few weeks ago about REACH and the updated procedures that they're putting in place across New South Wales, there will also be a link to have the recording sent to you. And as always, all details about these events and their registration information is available on our website at belongsidefamilies.org.au. So once again, thank you so much for joining us. I really, truly appreciate you taking the time out of your day, whether it's right now with us live or if you're watching back while you're cooking dinner. I really look forward to seeing you all at a future Belongside Families event. Enjoy the rest of your day. Thank you again, Annette. It's been lovely. Thanks so much,
Thank you.
guys. Bye.